My name is Melannie Teitsma. I'm a Skills for Nursing student here to demonstrate a chest tube dressing. So I've already done all of the necessary safety checks, and I've already checked that it's draining into the drainage container and that this is the correct patient who is supposed to be getting a chest tube dressing at this time. So I'm just going to be demonstrating the dressing alone. So we're already in the room. I have all my supplies and I'm all set up. He already has an analgesic ready. So I'm just going to get started right away, okay? So I'm just going to open up my sterile field here. And I won't be using the drape or the garbage bag because in practice I generally like to use an absorbent pad and a garbage can instead. So I'll just be putting these aside. And I'm just going to start adding things into my sterile field. So I'm using old supplies, reusing stuff, but of course in practice this would all be new and I'm just winging back. So the first thing I'm putting on is a Jello net. This is the netting that we put directly around to kind of prevent any air from escaping or going in. This is the IV sponges we put in two different directions to kind of make a nice covering there, and then we wing back this as well. The gauze is kind of coming out at the top, but in practice it would be all the way in and I wouldn't have contaminated there. It was just popping out because I apparently didn't pack it well. So in practice, we wouldn't have had that issue at all. We're also going to be adding here some water. There we go. For the cleaning. And for my demonstration, I'm going to be doing half no touch and half sterile glove. This is my personal preference. So for the no touch technique, I'm just going to be using these forceps here. Okay, so now that I've done all of that, I'm just going to perform hand hygiene, put on my gloves here, and I'm going to move to the actual chest tube dressing. I've positioned my patient in such a way that their hand is kind of above. This generally works okay for all of my patients that I work with chest tubes, and that way I can access it okay, especially if it's a pleural chest tube is what I'm referring to here. So I'm just going to be stabilizing this and taking off the chest tube dressing. Okay, it all kind of came off in one, but you can see it has the 4x4 in both IV tubing and also the MEFIX. And then now I'm just going to remove my gloves, perform hand hygiene, and then take my blue forceps here and remove my Jello net and just dispose of both of those. So now that I have that, I'm just going to put on one more pair of gloves. Got a whole camera in here. And immediately I'm just going to assess for any issues. So first I'm going to check if there's any hint of an air leak. So I'm just going to palpate around. And I see that there's no Rice Krispie crackles, so I don't see any subcutaneous emphysema. There's no evidence of an air leak I can see right here, and no evidence of immediate drainage either. I can see it's all draining well into here. So now that I've done my immediate assessment of any issues, I'm just going to perform hand hygiene again and then start cleaning, and then I will actually do my full assessment. So I'm just going to get my forceps here, and I'm going to start making some rosettes for the cleaning. So just the one here. Okay, one. And I'm just gonna start down low and just go full circle around. That's one. Okay. Two circles around, and I'm just trying to clean, having one swipe per gauze, of course. That's something I just kind of do naturally, but it's good to verbalize that once I touch down a gauze, I will not be lifting it up and dabbing. I just go down once, maintain sterility in that way. Okay, and so now I'm just doing my third circle around. So now I've completely covered the entire area where the MEFIX will be covering. So we've cleaned enough of that immediate area. So now we'll just get on with cleaning the actual tube. I ran out of 4x4. I ran out of 2x2s here, so I'm just going to use 4x4s, which work just as well. So I'm just going to make a forcep here. Okay. Make sure I have a good handle of it. Okay. And I'm just going to do one on the top, one on the bottom. In practice, whenever I do a chest tube dressing, I've been on CR4 for a while, and we have lots of chest tubes there. Generally, the chest tube will be dry by the time that I actually need to dry it. So for the sake of this demo, I'm just going to be cleaning the chest tube area, and then cleaning the chest tube as I'm doing right now, and then drying the chest tube area, but then I won't be drying the chest tube because it'll probably be dried by then in practice. So now I've completely cleaned the chest tube itself in the areas that I needed it to. So I'm just going to dry around. Just one swipe. And just because I'm using 4x4s, I'm only going to do 2 swipes around.
Is the game on?
Okay, and I'm just going to go around a second time. And just because these are 4x4s, I've completely covered my area already and it's all dry. So now that I see that it's dry, I'm just going to assess my chest tube here. I see that the sutures are in place and there's no immediate drainage, as I already said before. There's no redness or erythema, no swelling, no signs of infection, no foul odor. Like I said already, no signs of an air leak, and I see also no bruising or anything like that, any injury around the area. So I see that it all looks really good, and most importantly, the sutures are intact, and the peri-wound skin looks great. So that's all stuff that I'm going to be documenting, that it looks very healthy and normal. And then it looks like it's also draining well into the drainage container. So now that I've completely done my assessment there, I'm going to start with the chest tube dressing, and in this part I like to do in a sterile fashion with my sterile glove technique. So I'm just going to open up my glove here and don them. Okay. I don't know if you can see that. Okay, and with my second glove I can touch any part of the glove, and I'm just hooking the outside here. So I managed to maintain sterility throughout putting on the sterile gloves. I don't know how much you could actually see, but I maintained sterility throughout. And I'll just throw that out. Okay, now I can access anything within here. So I'm just going to start with my Gelinette. So this part you can technically do in a no-touch technique. So you can use forceps to peel off the Gelinette instead. I personally, it takes me a really long time and I'm not as dexterous, so I prefer to just do it with my hands, and it goes a lot better for me. Okay, so I'm kind of already shaping it with my hands here, as you can see. And now I'm just going to be nicely weaving it under. Okay. Trying to do as much work as we can before we get there. So the Gelinette is the only sterile thing on here. We can't autoclave ourselves, and we can't autoclave the chest tube while it's attached to the person. So they will never be sterile. So I don't know how much you can see, but I'm only touching the Gelinette here, and I'm not touching the skin or the chest tube. And if I were to touch the skin or the chest tube, then I would have to say that that hand is contaminated or that finger is contaminated, and I wouldn't be able to use it anymore. So I'm just touching the Gelinette here. Okay. Okay. Are you able to see from there?
Mostly just your gloves.
Oh, sorry. So yeah, as you can see, just touching the Gelinette here. Thank you. And I created a good seal around the actual chest tube site, which is what matters. And so I managed to go all the way around. So now both hands are actually still sterile because I was only touching the Gelinette, no skin, no chest tube. What?
You're at 10.
I'm a 10. Okay. So now I'm gonna go to the next part where I'm gonna be taking my IV tubes here, and still, since both my hands are sterile, I can access anything I want in here. And I'm just gonna place it around, making sure if I want to keep my hands sterile, I can't touch anything except for my sterile equipment here. So now I'm gonna put on this IV in just a separate way. And at this point, I'm going to purposefully contaminate my right hand. So I'm going to grab my chest tube here. And that way I can kind of fit the IV around. And now my right hand will be acting as a clean glove. And my left hand will be acting as a sterile glove. And this is something that I often do in practice as well. Ease for me. So this is my contaminated clean hand. This is my sterile hand. So I'm just going to reach in here with my sterile hand. And just place this on top. There we go, and that's the rest. So now we're gonna take these off because Meefix and gloves don't really get along. Gonna do hand hygiene again. Always do hand hygiene before or after having on gloves. It's something I do naturally, so I might have forgotten to say it a few times, but whatever. So now I have the Meefix, which is not sterile. So that's why I'm touching it with my hands here. And I have two parts here. I just like to note that I already signed and dated it at the bottom so that the person will know when I did it. And that's also something I include in the flow sheets. So now I'm just going to be opening up here. And the patient is tolerating the procedure well. That's something else I will have in my documentation, is how they're doing during the procedure. And if they had any pain, sometimes pain can be a good marker for issues. Especially when I'm palpating around, if I feel that there's any like fluid leak there. Often the patient might feel some pain if there's something wrong there. But so far my patient has been tolerating it well. So the Meefix on the top is kind of like tape over top, so it doesn't need to be sterile, as I already mentioned. Obviously, we shouldn't be getting our hands all over it, but it's more of like a securement dressing than an actual part of the sterile dressing. Okay. And it doesn't like me today. There we go. Okay, so now I'm just going to put on the second one, making sure that it overlaps the first part of Meefix so that we're going to have a complete seal around. And also making sure that I'm able to tent around the chest tube so that the sutures can remain in place and that the person is not constantly tugging on it every time they change position. So I'm just going to be putting it down here. Okay. I don't know if you can see my chest tube dressing there. So now that I've completely done the chest tube dressing and it's nicely tented around, I will just clean up all of my supplies, ask the patient how they're doing, and then I'll document everything, including the fact that I did the chest tube dressing. If I had any concerns along the way, I didn't. So I would just say how healthy the tissue looked and everything, and that the sutures were still in place. Another thing I will be regularly documenting is the amount of drainage that we get. For the sake of this scenario, I'm just pretending that it's a pleural chest tube. So just documented the drainage and hopefully getting rid of that. And so yeah, now that I've completely done all of that and I've documented everything, that's the end of my demo. Thank you.